Post-traumatic stress disorder is a mental health disorder which can affect an individual who has witnessed or experienced a traumatic event, a series of traumatic events, or a set of adverse circumstances. This may affect the individual in his physical or emotional well-being, and it could be harmful and life-threatening. It may affect the mental, physical, social, emotional, or spiritual well-being of an individual. A few common examples or types of traumatic events include natural disasters or calamities, serious accidents, it could be road traffic accidents as well, sexual assaults, acts of terrorism, experiencing historical trauma, war, combat, experiencing any intimate partner violence, and last but not the least, any serious bullying. Symptoms of post-traumatic stress disorder may fall into the following four categories. Intrusion. There could be intrusive thoughts, which may be experienced by involuntary memories, distressing thoughts, and dreams. There could be the dreams could be so vivid that the patient may experience the entire traumatic event. It is as if he's seeing the entire visual in front of his eyes. Myth number 1. Post-traumatic stress disorder only occurs in war veterans. No, the fact is it can occur in any individual who has experienced a traumatic event or a series of traumatic events. It can occur in people of any walks of life. Myth number 2. Post-traumatic stress disorder occurs immediately after a traumatic event. No, the fact is in certain individuals, post-traumatic stress disorder can take months and even up to years to develop. Myth number 3. Post-traumatic stress disorder is a sign of weakness. No, post-traumatic stress disorder is not related to weakness. It is a diagnosable mental disorder which is linked to certain chemical changes in the brain, and there is an altered response to fear. Myth number 4. Everyone with post-traumatic stress disorder will experience similar symptoms and signs. No. The fact is, individuals will vary in terms of symptoms and severity of post-traumatic stress disorder. Myth number 5. Patients of post-traumatic stress disorder are very violent. Well, the fact is, not every patient experiencing post-traumatic stress disorder shows violence. In fact, individuals who are on substance abuse tend to be more violent compared to others. Another myth, post-traumatic stress disorder will go or resolve on its own. No, the fact is, the individual who has repeated symptoms may need medical help and attention, and sometimes even medications. Another myth is that post-traumatic stress disorder cannot be treated. No. The fact is, post-traumatic stress disorder can be treated, it can be diagnosed, and there are various treatment modalities for its treatment. To be diagnosed with post-traumatic stress disorder, the individual must have all of the following symptoms for at least 1 month. At least one avoidance symptom, at least one re-experiencing symptoms, at least 2 symptoms of alteration in mood and cognition, and at least 2 re-experiencing, and at least 2 arousal and reactivity symptoms. Some of the treatment options for post-traumatic stress disorder include cognitive behavioral therapy, group therapy, family therapy, and yes, medications. Convergent evidence suggests that post-traumatic stress disorder can precede or exacerbate depression, anxiety, suicidal tendencies, substance abuse, eating disorders, and psychosis. One of the earlier signs of post-traumatic stress disorder is sleep disturbances, which may include insomnia. The individual may have nightmares. He or she may wake up multiple times at night. They may have unrefreshed sleep, difficulty falling back to sleep.